Don't know that I ever received formal training on how to respond to a pandemic of several million people.
You know, you hear some people saying that that's what you're trained for. Like, actually, this isn't what anyone really ever expected.
Their messaging to us was this is probably going to be your once-in-a-career situation.
Felt like you were preparing for war whilst providing a service for the patients that were in front of us.
When we heard of spread outside of China to other areas, that was really clear that our usual systems weren't going to cope with the evolving pandemic. We might need to take 200 or 300 patients in ICU. Looking at our peers and colleagues overseas, that was their reality.
Seeing what was happening overseas and, seeing all these healthcare workers getting sick, you definitely think like, oh, is that going to be me?
We got to the problem of trying to create space in places we didn't have.
We learned a lot about the virus very quickly in preparation because we were very worried about what we would have to do, what novel therapies we would need, where do we get drug X, does hospital have drug Y, all these kind of things behind the scenes.
We've changed the whole way our emergency department runs. We've had an external triage area built to, make sure that the public wasn't anxious about coming into hospital and being exposed to COVID.
We've had to increase the numbers of hours that the lab operates. We've rostered extra people across weekends and overnights.
Adapting to what new policies and procedures would be put in on that morning, and the next day would probably change.
So I'm a clinic nurse. To then step up and get into the call centre and do assessments over the phone, it's tricky.
We were nominated by the Austin Hospital to become the COVID positive ward. When we first started, I was thinking, God, I don't know how I'm going to manage staying in this for 8.5 hours.
I was fearful of having to turn away people that needed good care. And then you would go to a meeting from the Department of Health and they'd show you these graphs. And whenever the bar went like double the amount of what we could take, you're thinking, well, crap. So modelling really caused a lot of strain on us.
I had a massive panic attack. I got my dad to sort out the caravan in their backyard in case I had to, isolate.
We created a room that was our ED breakout area where you could just go and sit and cry.
I found it difficult to read books, watch TV, have conversations about anything other than coronavirus. We just felt the need to be so abreast of the science so that we could provide the best care, and we were writing the guidelines for how we would treat patients, that there was just no minute of the day that wasn't devoted to coronavirus.
It does make you think, like, how far would you go for your job?
It feels like a military kind of operation, to be perfectly honest. A lot of it wasn't about medicine, it's about coordination.
And then the other thing was really the constraints in the supply chain. So things like equipment and reagents for testing people, PPE, medications, and so forth. We were very fortunate that we didn't have to go through a really large first wave to buy us time to be able to prepare if we did have that surge for this second wave. People have used this bushfire analogy. It's like having the embers from a fire there. While you've still got embers, there's still a possibility of things taking off again. One of the things that, I've been reflecting on, particularly the second wave, is really when I think about what infection control is about. We always want to do what is right for our staff. It's about communication and education. I think if we can get people doing the basics well, that really stands us in good stead. The challenge for us is really around managing our workforce, staff fatigue and things like that.
I feel very privileged to be in a safe place like Australia and in a very controlled way be making a meaningful contribution.
Austin's always been a really good team. I've worked here for 20 years and I certainly wouldn't be going anywhere else.
I don't think I would have envisaged so many units working collectively together.
These sorts of things often bring out the best in people. People either just step up to the mark and just do what they have to do, or the other option is just to sit and cry in the corner, which sometimes was an option I was contemplating.
We're a great team. I'm very proud to work where I work.
There's a lot of uncertainty, and I think there's a few times a week that I'm called to bring out my crystal ball and say what's going to happen over the next few weeks.
I hope that this just fizzles out like previous viruses have, and I will go back to being a general medical nurse.